Hi, my name is Dale Ding, and I am a vascular neurosurgeon with UofL Health. No, I think I was just interested in sciences, and then as I got more exposure to the medical field through shadowing, I thought it was something that would be interesting to me. I liked the fact that you could interact with patients, but also that it was versatile enough that you could also do research and be involved in teaching, and it was kind of a lifelong learning process. So that's what really drew me to medicine. I'm one of the neurosurgeons at University of Louisville. I specialize in vascular neurosurgery, which is the treatment of stroke. So there's two major types of strokes. There's a bleeding type of stroke called hemorrhagic stroke, and then there's the kind of classic stroke, which is having not enough blood flow to the brain, and that cuts off the circulation and it causes that part of the brain to die. So that's called ischemic stroke. So I treat really all causes of ischemic and hemorrhagic stroke. And we treat them through two kind of broad ways. One is what we call minimally invasive or endovascular, and that's threading a small tube or a catheter through the artery either in the wrist or in the groin, and then trying to navigate that catheter through the blood vessels, much like getting on the freeway to get where we need to go to treat whatever is causing the problem. The other way is through traditional surgery, and we still do that sometimes when necessary, and that's to remove a piece of the bone, which is something called a craniotomy, and going in either through the brain or between different parts of the brain or under the brain to, again, get to wherever we need to go to treat the problem. The most important thing with patients anywhere is to really kind of make sure that they understand we're on the same team, so I'm on their team, they're on my team, and really try to educate them as much as possible about the disease process that we're treating. A lot of patients that come to see us in neurosurgery don't need any kind of treatment, and I think that's a big part of talking to them and letting them know that whatever is going on is not really that dangerous, and that they can go on and live their lives. I think we tend to take care of more challenging patients and more challenging diseases. So even though our volume may not be any greater than any of the other regional centers, I think that the complexity of patients is probably higher. I think the patients come in and they're sicker, they have more medical problems, and a lot of times their actual vascular issue ends up being more challenging as well because of all those things that I just mentioned. My big hobby outside of work is playing pool. So I shoot pool locally at a couple of the pool halls, and it's a great way to relax and also meet people outside of the hospital. And it's something I've been doing since high school. So I didn't really do it a lot during training. I kind of stopped playing for about 10 years when I was doing training and when I first started here. But in the past couple of years, I picked it up, and it's been great to get back into it.